Let's watch more grilling of Trump's nominee for OMB, Russ, Vought, a major contributor on Project 2025, by the way, as Trump has now appointed multiple authors from it to head different agencies, while his executive orders mirror Project 2025 as well. So, I told you so. But let's see more of what was said by the man who will be looking over the Medicaid budget if Trump gets his way.
Now, I listened very carefully to the exchange you had with Senator Murray. And you had a very clear opportunity to say, yes, you will comply with the Impoundment Control Act. I didn't hear you say that. So just to give you another chance, will you comply with the Impoundment Control Act?
Senator, the president ran against the Impoundment Control Act.
This is, Mr. Vought, I know what the president did. He wants to change lots of things. He can submit legislation to do that. But you are going to be the head of OMB, and here today at this hearing, you're refusing to commit to comply with the Impoundment Control Act. Is that right? Are you refusing to commit to complying?
I want to be clear about what's being signaled here, because it's essentially that all bets are off. The Impoundment Control Act is essentially what prevents the president from being able to unilaterally pull funding from any one thing, even if Congress approves it, having to instead go through Congress, where they're approved bipartisanly. This is something Trump has tried to circumvent before. He was impeached for it with Ukraine, when he tried to withhold Ukraine aid, essentially to blackmail them into sending him dirt on Joe Biden, where now the Medicaid budget director is saying, or he's refusing to commit that he would withhold this law or uphold this law because Trump ran against it. That doesn't make it not a law, meaning there's no guarantee that if Trump tries to withhold funding from Medicaid, say to, I don't know, fund his tax cuts for billionaires just at the stroke of a pen, this guy isn't going to prevent that from happening. This is, again, unprecedented amounts of power that these guys are trying to concentrate under the executive, where they alone, the president alone now, can wipe away massive parts of our budget without congressional approval. It's no surprise that it's the Project 2025 guys admitting that they want to pull away these fabrics of our democracy and the checks and balances it can provide.
You've been a big advocate of work requirements. You encourage states to adopt waivers that would allow them to do that for Medicaid. One state tried it, Arkansas. It produced no increase in the hours worked, no increase in employment. It failed. Why did it fail? Because the way that people are able to work is when they're healthy. When they can't access health care because you want to cut it off, they're really trapped in poverty. Now that your idea failed so miserably, are you going to advocate for it again?
You know, Senator, one of the major legislations that our side has been very proud of since the 1990s was the impact of welfare reform in the 1990s. It led to caseload reductions, people getting off of welfare, going back into the work, and give people, again, the dignity of work.
And you believe cutting off health care encourages people to work when they need to get better health in order to work? It doesn't make any sense.
I don't know any other way to say this other than people who want work requirements on healthcare are literally the devil, because most people who can't work because of health reasons. They tried this in Arkansas also. Almost 20,000 people lost coverage. Obviously, thousands were in constant stress of losing coverage, and the program failed within years. But these people want to bring us back to these draconian times that I think a lot of people just don't remember, that I got to see a bit firsthand from my dad, where they want to roll back Obamacare. They want to take us back to where insurers could deny you if you have a pre-existing condition that they deem to be too expensive, with work requirements for Medicaid and Medicare, practically enslaving people to their jobs, as being able to have health coverage was intertwined with employment. You're under constant stress and fear, and thus you're more accepting of whatever unfair conditions your boss wants to impose on you. We've made huge advancements from moving past this, and it's allowed huge advancements specifically for the labor movement, and that's exactly why these corporate shills all want to come and undo it, because at the end of the day, it hurts their bottom line.
We want people to be traumatized. We want people to be traumatized. I've heard 1 million people in this room give speeches about we want to cut the budget, we want to reduce federal spending, want to deal with the deficit, but I haven't heard anybody give a gleeful speech about traumatizing the federal workforce. You don't want federal air traffic controllers going to the airport traumatized, do you, Mr. Vought?
No, Senator.
You don't want the people inspecting our food, our medicine, our infant formula. as federal, you don't want them to go to work traumatized, do you?
No, Senator,
You don't
nor
want the
have I said
people
that.
interdicting drugs at the border. You don't want them going to work traumatized, do you?
No, Senator.
And you don't want people who are working for you at the OMB, who many people would think, well, they're in the White House, they must be, you don't want them traumatized, do
No,
you?
Senator, thank you for expanding on that.
Bureaucrat is just another word that MAGA thinks they hate because Trump told them to, where most people in MAGA couldn't even tell you what a bureaucrat is. And it leads to hilarious moments like this. He literally goes, well, thanks for clearing that up, that I don't actually want to traumatize bureaucrats. Because again, bureaucrats are the ones doing the mundane jobs that allow the government to function in a nonpartisan manner. For some of the more relied on systems or functions of the government, they're the people who work at WIC to make sure that moms have formula. They're the people who work at the CFPB endlessly to return your money after you get scammed. They handle the paperwork side of Medicaid and Medicare so your grandpa and grandma can have health care. They're the people who aren't political, at least not professionally in the way that a politician is. I'm sure that they vote, right, like the rest of us, but instead they have expertise in the field and were hired just like anyone else for any other job, non-federal job, based on their qualifications and their merit. If we want to talk about an issue that can exist with bureaucrats, it would be in the appointments that a president can make, these heads of the agencies, where, like we see with Trump's cabinet, unqualified people who would never get elected and probably never get selected through a actual merit-based hiring process are allowed to be thrust into these roles by Trump. It's not the people who are pushing paper to make these agencies run how conservatives want to tell you. It's the essentially DEI hires, as MAGA wants to pretend is black people, is actually just these billionaires that Trump is handpicking. It's just so they can justify things like the Schedule F executive order that they tried last time Trump was in office, where he could then fire at will federal employees, nonpartisan federal employees, only to further fill their positions with partisan loyalists and yes men. This is especially damaging in agencies where Trump's goal is to appoint people to destroy the agencies, not to have them run as efficiently as possible, like with the Department of Education or with Medicaid, right? Where you see this in the joke of appointments he's made with Linda McMahon for the Department of Education, despite no experience, or Dr. Oz, the TV scam doctor, to head Medicaid. But it's okay. I mean, this is blatant fascism, but MAGA's like, who cares? Because it feels like their side winning. So it doesn't matter to them that all this power is being consolidated under and around the executive.